All right, let's dive right in. In this explainer, we're going to do what we do best. We're going to take some pretty dense, complex research and break it down into a simple, clear guide. We're going to be looking at some really fascinating science around supportive care for Hodgkin's lymphoma, all designed to help you or your loved ones feel a bit more empowered on this journey.
You know, after a diagnosis, once the main treatment plan is in place, this question almost always comes up. What else can I do? It's such a powerful human question, and really, it's the perfect place for us to start. So let's dig into some of the answers that are out there.
And the great thing is, that question doesn't just have to hang in the air. There is a ton of scientific research out there that's starting to provide some real, evidence-based answers, different paths that might help support the amazing work of conventional medical treatments.
Okay, before we go any further, I've got to pause here because this is, without a doubt, the most important slide we're going to look at. Let me be super clear. This is not medical advice. The whole point of this is to connect you with the science so you can have a better, more informed chat with your oncologist. Think of us as a bridge to that conversation, definitely not a replacement for it.
Now, the amount of research out there can be, well, a bit overwhelming. So, to make this easier to digest, we're going to zoom in on 3 specific areas where the data is just really compelling. Think of these as a few bright spots that show it's possible.
So let's kick things off with our first spotlight. And this one comes from a place you probably wouldn't expect at all, the allergy aisle. Yeah, researchers started noticing something pretty interesting when they were looking through patient records.
And what they found really boils down to this one single number, 60%. In one study, using a specific antihistamine was linked to a 60% relative reduction in the risk of cancer mortality for Hodgkin lymphoma patients. I mean, a number like that, it just makes you stop and say, whoa, okay, what is going on here?
And the story behind that number is just as important. So this wasn't some random guess. It came from looking at the records of 201 people with Hodgkin's lymphoma. The specific drug they called out was desloratadine. But here's the really crucial part. The same huge effect was not seen in patients with non-Hodgkin's lymphoma. That little detail suggests there might be something very specific happening here. All right, for our second spotlight, we're shifting gears to something you've definitely heard of. Vitamin D3. You know, the sunshine vitamin. Its connection to our immune system is something scientists are getting more and more excited about.
This chart just says it all, doesn't it? This comes from a study of 351 Hodgkin's lymphoma cases. On the left, that's the 10-year survival for folks who were low on vitamin D. And on the right, that's for people who had enough. The difference between those two bars is, well, it's pretty hard to ignore.
Let me say that in a different way, using the actual words from the research. Having enough vitamin D was linked to more than double the progression-free survival rate. That's huge. It just goes to show how much of a difference this one factor seemed to make in this group.
Okay, for our third and final spotlight, I want you to picture one of those old-school balance scales with the little trays on each side. It's actually the perfect way to understand this next idea, which is a key marker of inflammation that researchers are watching really closely. It's called the neutrophil to lymphocyte ratio, or just NLR for short. Now, don't get hung up on the long name. It's a super simple marker that comes from a basic blood test. All it does is show the balance between 2 of your key immune cells. When that scale is tipped way over, when the NLR is high, it's a sign that there's more inflammation. And that's been linked to a tougher road ahead.
So, how much does keeping this scale in balance really matter? Well, get this. In one study, the patients who kept their NLR low and balanced saw a 70% overall risk reduction compared to those whose scale was tipped. 70%! Again, it's another one of those massive numbers that comes from a really simple marker. So, of course, the next logical question is, okay, if my scale is off balance, is there anything I can do? Well, that's exactly what researchers are looking into. And one potential tool that's popped up in the science is an herbal supplement called astragalus, which has been studied for its ability to help gently nudge that immune scale back into balance.
Now, those 3 spotlights are pretty amazing on their own, right? But I want to make sure you know they're really just the tip of the iceberg. So let's pull the camera back for a second and take a quick look at the much bigger world of this research.
I mean, just have a look. You've got research digging into gut health, where having certain good bacteria like Akkermansia seems to be linked to better therapy success. Then there's iron balance, where something called lactoferrin might help. And even on the cellular level, a special kind of vitamin B3 is being studied to help the body build back its white blood cells. It's just a lot, and it's all happening right now. So what's the big takeaway from all of this? The antihistamine, the vitamin, the gut health, it's not to go out and create your own treatment plan. No, the real point is that there is solid evidence-based science out there that shows you can be a curious, engaged, and active partner in your own health journey.
So what does that actually look like in the real world? How do you take all this information and turn it into a real, empowered next step?
It's actually a pretty simple 3-step path. First, you explore the research. Then, step 2, as you learn, just write down your questions. What about this? Could this apply to me? And finally, the most important step of all, you partner with your doctor. You share what you've learned, you ask those questions, and you build a plan together.
And really, that leaves us with one final thought to send you off with. After seeing all this, after realizing you can be an active member of your own team, what's the first question you'll ask?